Very good afternoon, everyone. Hope it's an afternoon session. I'll not make you to sleep because I'll keep this presentation very simple and also which is more applicable for your practical point of view. And I think you're all experts as of now. And these are all some of the tips which I can give being from the Department of Shalyatantra, so that you can just take up these messages, ignite the informations in your brain and start rereading the texts of Ayurveda. And also along with that, you can even take the inputs from modern textbooks, and you can develop your own kind of treatments in emergency conditions. This is what I wish, because we also started from the scratch. We were also not knowing what to administer in case of emergency in terms of Ayurveda medicines. But later, once we were clear with the concepts, we started to give Ayurveda medicines in the emergency management of patients. And there are certain factors we must remember when we are practicing in an Ayurveda hospitals, and when we are treating the patient's illness, and also when we are just expecting some kind of emergency situations, how our behavior should be there towards the patient. So these are the fundamental points which I am going to discuss in my presentation. First, let us learn what is the word meaning of emergency. We know emergency is do not expect a kind of life-saving moment always. Just go with the very minor events which we come across in our daily practices. So what is an emergency condition or emergency situation? So it's a serious, unexpected. You have not expected so far this kind of symptoms will arise to the patient, or you have not experienced this may be the response of patient towards your treatment. So that is an unexpected, serious, but often it can turn into a most dangerous situation also, where you require to act immediately. So that is a meaning of emergency. The word emergency, it's applicable to so many conditions also. Like it can be a medical condition, or it may be in a situation where you are trapped and all. Next, usually the second point is more applicable, because from the day of when we were students, most of us might not have seen an emergency happening because of Ayurveda medications or during the Ayurveda treatments. So there will be a point in our mind saying that there will not be any emergencies in Ayurveda hospitals. But that's not so, because we do have some kind of emergency situations. So they are not more likely to be appreciated in the Ayurveda hospitals. Instead, will less encountered. You cannot say that you will never expect it, but compared to the statistics with the modern hospitals, we are less expected or less encountered in the Ayurveda hospitals. Next, whatever may be the emergency situations or emergency conditions that we have to address to a patient in the emergency management, or it is called as emergency comprehensive emergency program. So it comprises of 4 limbs. All the meanings of these words you will be knowing. These are the 4 phases of emergency management. Each one of us, being a clinician, being a practitioner, you are practicing Panchakarma therapies also, but still we should know these 4 limbs. They are, one is a preparedness. The first limb of emergency medicine becomes the preparedness. The second comes the response. Third is the recovery, and fourth is the mitigation. It's applicable in the modern system of medicine also. There is no doubt the same 4 limbs are applied even in the casualties or even in the cardiac centers also. Okay. So what is this preparedness? So whenever we are performing a surgical procedure, for example, my department is different, or if I am applying the same principle to your department, if you are performing a procedure, maybe a Vamana or Virechana, so there are set of emergencies, there are set of complications that happens during the treatment or after the treatment. So are you prepared in your mind for all those complications, or do you have all these facilities to encounter those kind of emergency situations? So that exactly comes under the heading of preparedness. Whether the consultant or the doctor is prepared for the situation, or whether your organization has a setup where you are prepared to manage the emergency situations. So this is the first limb of emergency programs. Okay. The second comes the response. Okay, you have encountered an emergency situation. How do you respond? Do you have medications? Do you have emergency care system in your hospital? Whether you have trained doctors, whether you have trained nursing staff, or whether you have a casualty medical officers. So these are the facilities will again decides how you are going to respond. Okay. In the response also there is the importance of emergency medications also. So these setup, when you go back to your institution, you can set these 4 limbs, and in your Panchakarma theatre also you can set these are the 4 limbs of emergency management, what the person has to look after. You can assign this duty to your PG scholars or the interns. They'll do it very well. Okay. Next comes the recovery. You have a situation, you have a medicine, you have a trained staff, whether the patient is recovering. This is also a question. You have a situation, you have given a medicine to that patient, whether the patient is recovering. Are you observing that? If it is recovering, your purpose is served in the third phase. So if it is not recovered, you have to refer to the higher centers, tertiary care centers or tertiary care hospitals. So there lies the mitigation. Means we have created an exaggeration of a symptom that is cannot be, we have managed to certain extent. We need an expert opinion for that, and also expert management system is also required. So we are referring to the higher centers for the optimum health attainment of the patient. So that is also our responsibility. It's not that a patient has come, you have treated, half of the symptoms are relieved, discharge. No. Whether the patient attains the complete mitigation of his or her illness. So that is also very important, and it is an responsibility of each of one of us. Okay, because they trust on us and they'll come to us and to show the direction where if he's going and what will be the outcome they are going to get. So that will be the end point of this emergency management. Once you have touched the emergency case, you should follow it up until the mitigation of the illness. It's an absolute responsibility of each one of us in the management of emergency medicine, emergency conditions. So when we come to the emergency situations which we encounter in our casualties or in the medical colleges or in hospitals, in the textbook they say these are the commonest emergency situations irrespective of the disease condition, irrespective of the symptoms of the patient. We are going to get, these are the minimum modalities or 7 modalities of the emergency situations any one of us can face in our practice. So what are those? It's a bleeding, then comes breathing difficulties, next is someone collapses. It's a common language, local language, we call it as collapsing. What is it in medical term? It's a syncope. This comes whether there is any fits and all, or epileptic seizures because of exacerbation of the underlying illnesses, or severe pain. Pain is there, patient has come for the treatment of pain, the pain has suddenly increased. So that is also an alarming symptom. Next comes an heart attack. This is most commonly happening thing during most of the treatments and also in the outset. So we have to be careful how it will be predisposing in a patient and how we have to interfere in such conditions. Last comes as a stroke. So these are the 7 set of symptoms which we can expect in case of emergency situations. This is, if you refer still more points, you will get like 5 folds of emergency conditions, 20 common emergency situations, and there are lists. But commonly we can categorize under the 7 headings. Okay, and I feel that all of us are aware of these kind of situations. Most of us have experienced or encountered patients like bleeding or breathing difficulties or even syncope, and these epileptic seizures or pain. If not heart attack, or if not it is a stroke. Yes or no? Yes. Okay. So I would say that why this emergency conditions happens in our body. What is the reason for that? Can anyone tell why these emergency situations will be encountered by the patient? What may be the reasons? I have listed few of the reasons. Why this slide is jumping? Okay. What may be the commonest etiology? Why we get these kind of emergency situations?
Administration of the procedure in a contraindicated condition.
Administration of the procedure in a contraindicated condition. Fine. Ati yoga is one of the reasons. Allergic reactions.
Improper history.
Yoga of open.
Okay.
Selection of inappropriate medications, doses, duration.
Okay. So all those, yes sir?
Allergy of any.
Yeah. All those points what you have explained, I have categorized under 4 headings. They are all, one is a major one, fluid and electrolyte imbalance. Yes, because all of you are dealing with the fluid and electrolyte of a patient. Is it not? You are giving some inputs, we are also expecting some kind of outputs. There is always exchange of ions, exchange of the gases, even exchange of nutrients. Everything is working on the basis of fluid and electrolytes. So, what is another reason for that? Another reason for the emergency situation is the same thing is there on the slide. It's an altering of the hemodynamics. You have studied in the first class of your seminar was about the Rakta Mokshana, is it not? So we are touching the hemodynamics of the patient. Hemodynamics means something related to the circulatory system, blood and its components. So we are touching to the hemodynamics of the patients. So that's why there will be a chances of happening of the emergency situations. There may be a hypovolemia. There may be a components like corpuscular components are decreased. Plasma has been decreased. Exchange of ions have changed. Oxygen supply has been changed. So because of that, there will be chances of encountering an emergency situations. That's related with the hemodynamics. The third point is vasovagal shock. This is a most important condition a Shalya person is always worried about. It's about the vasovagal shock. So when we are introducing a therapy to the patient in a highly sensitive area without much of the preparations prior to the procedure, there may be an anxiety. Along with that, there will be a vasovagal response to the patients. This usually happens, I have seen in emergency conditions of vasovagal shock happening in the labor theatres, because when the descent of head happens, they are going to give an enema to the ladies. So the intense pain is there, and also they are inserting enema can to the anal verge of the female. Both the perineum means the perineal pain is going to accelerate the females. Just a moment they'll go for a syncope, or there may be a chances of a response like this. This is also at the beginning of the vasovagal shocks. So in such conditions, we have to be very careful, and we have to, we are able to expect such conditions during our treatments, and we have to be prepared for that. You know, you might tell that we are doing 50 cases per day. Fine, 51 case may be a troubling to you. Okay, so once we are prepared for all these things, then we are in the safe zone. Otherwise, we will be troubled one or the other day. In any one day trouble to us, it can hamper whole of our career. So that is a very important point. Next comes adverse drug reactions. See, this point hardly an Ayurveda doctors or Ayurveda community people are over exaggerating. No one is explaining about the adverse drug reactions. Are you explaining it? In all our thesis at the end, we are telling that the drug was safe and effective. Is it not? So nowhere we are exposed to such situations, or not. We are bold enough to say that yes, there is an adverse reaction. So it can happen, yes, because you are seeing every day. If you apply some vapor to a patient, next day he or she will complain that there is itching, there is burning sensation, there is hives, etc. What is that? It is also a kind of drug reactions. You may feel your skin is sensitive, your body is sensitive. What is that? It is a response. It is an anaphylactic response or the drug reactions. So this can trigger a kind of emergency situations. So do not neglect such conditions when happens to your patients. It may be a minor conditions in the initial days, or one or the other day it can pay a lot for you, because it can even cause a respiratory arrest to the patients. Because in the coastal area, here we are getting most of the patients who are having raised IgE, serum IgE conditions. So it's in such cases, I have seen a patient who was calling me in the midnight and saying that after consuming a particular kind of tablets, it may be allopathy also, that has triggered his allergic reaction, and he is unable to breathe to an extent that his vocal cords also got swollen, and if he was delayed with 5 or 10 minutes, he would have gone for a respiratory arrest. That much of blockage was present. So immediately he was suggested to go to hospitals and get steroidal therapies. So that is secondary, but that kind of conditions also we can expect, and this patient was under our treatment for something else also. So we don't know whether medicine has caused, whether any other external factors, food has caused and all. So those kinds of cases also we have to note in our day-to-day practices. Okay. So there is some technical issues. Okay, let me continue. No problem. All of you are aware of fluid compartments in our body. Yes? What are those compartments? Intracellular, extracellular, interstitial compartments. These are the three important compartments of fluid in the body. Being a Panchakarma practitioner, you are targeting which compartment fluids? All? No. There is some no. Huh? Being an Ayurveda practitioner, in that specific to Panchakarma practitioner, in which fluid compartment you are working? all. Even all comes under for me also. Specifically, any one compartment where most of your treatment will end up in which compartment? Yes, it is a interstitial compartments. It's not, we never go up to the intracellular compartments. It's a mode of action of the medicine will enter there, not the fluid exchange happens and it will be causing dehydration to the patient. But in most of the conditions, we are targeting at the level of interstitial fluids. It includes both extracellular compartment and the intracellular compartments also. Now, I'll ask you a question. Why in Pura Karmas, all the dravyas what you give or whatever you prefer as a Pura Karma is a Snehana, is it not? Snehana. Why you give this lipid media in the Pura Karma before going?
Easily absorbed by the all the mode of action occurs in lipid soluble.
Okay. Fine. Lipid can cross the cell barrier. Fine. Anything else? Cell membrane is made up of lipids. Fine. One extra point which directly says it is we are treating an emergency situation also, or in emergency situation you can depend on lipid based medicines. It's fine, but I need in terms of physiology. Lack of? Yeah, fine. Those are all there. It's a basic. One major component which we can appreciate in our Ayurveda medicines so that they can be given in the emergency situations. And if you take the chapter of Susha Samhita, Uttara Tantra, 46th chapter, Murcha Pratishedhi Adhyaya, almost all the preparations of Acharya Sushruta is in the lipid form. That is Grita. Yes? Huh? Yes, it's fine. There is one important point which takes a superiority is, huh? No, apart from that, in emergency it happens. Okay, this picture says that these are the points whatever available in all the physiology textbooks. It says that interstitial fluids are playing a major role in all our edema management and the mechanism of edema and how you are relieving edema. It all playing, our drug, our treatment therapies are playing at the level of interstitial fluids. Next comes, as you told, all the medicines which we administer through a lipid media is having a high affinity to the cell membrane, so that they are going to absorb it to the maximum extent and reach to the target cells. Fine. But there is one more point. We know that lipids are mainly composed of carbon and hydrogen. Okay. But there is also a ratio of oxygen in that. And the oxygen which is present in the lipid, when you administer it as a medicine, directly accelerates and absorbs in the capillary endothelium and reaches to the target cells. So if a patient is in emergency situations, you might have seen, like in COVID conditions, many doctors were treating in intensive care units by using gritas when the patient is in the nasogastric intubation also, because the oxygen carrying capacity in the lipid molecule, or the production of oxygen in the lipid molecule, is far higher. It is like 50% higher compared to the other base medicines. That's why it is completely known to all our acharyas. The shloka this chapter you can read after going from here. And also one of the important point, recent studies have shown even the aromatic substance which is present in the formulation, in a Grita formulation, it is absorbed, it is assimilated in the body far faster compared to other modes of administration. That's why we have all aromatic oils. Is it not? So that, and along with that, that reaching of these chemical components to the target cells is faster. Along with that, it carries a molecule of oxygen to the patient. So that's why in Morcha Chikitsa, if you go through all the treatments, whatever Acharya Sushruta has listed, in that either you have an aromatic drug, either you have a sweetening drug, or you have a lipid based drugs. Okay, so in all our emergency situations we need to maintain oxygen saturation. Yes, so we can maintain an oxygen saturation if we are administering a medicine which is having a base of lipids. And if you are taking care of the patient very proper in the Purva Karma, then the patient is not going to encounter any kind of complications during the treatment, because the homeostasis is balanced there itself. And that is the reason why we don't get most of the emergency situations when we are performing the Panchakarma therapies. You may feel that, yes, we are inducing the body to maximum discomfort, is it not, during the treatment? Still the patient will be fine. Instead, you skip 2 meals, you will be tired, giddiness, everything. On third day, you will be in the bed. Is it not? You will be bedridden. But that never happens in a patient who is taking Snehapana. Whether it happens? No. He'll be tired, or there will be a weight reduction, etc. But still the patient will be stable. Why? These lipid molecules are all supporting from the gross level to the from the very minute level to the gross level also. So this point you have to remember. I would appreciate all of you to just go and recheck with this chapter, so that your idea of treating the emergency condition is going to change. So in the emergency principles, general principles, you may be knowing ABC. It's called as a ABC, and one more is there D. That is a D is called as a drugs, and one more is there E, exposure. To what kind of exposure of the patient it created the situation, that also you need to document it. That is called as the exposure. So why I have kept this slide is, whenever the patient go for a syncope or tired, or the BP falls and collapses, or whenever we encounter a small minor conditions of emergency, all we will be like hands tied. We don't know what to do next. Most of our students will also be like that. If you are undergraduate students, they will be look very kind of desperate and tied, with hands are tied. So what is the first step you have to change is the position of the patient. Okay, so each position has its own importance, whether to make him to lie in foot end elevation, whether to make him to lie in CME recumbent, whether you have to tilt to the left, or whether you have to go for any other positions like 45-degree angles in case of breathlessness and all. What is the benefit of it? It improves the cardiac output. If there is a breathlessness, it relieves the congestion. If there is a low blood pressure, foot and elevation raises the cardiac output. The patient will not go to the worsening stages. So first is the position of the patient, then check for the vitals, then go for a blood sugar monitoring, then comes an oxygen support. So all of you should know the basic oxygen we have to give to a patient is 8 liters per minute. You have to fix that. Irrespective of the conditions, you have to start with the 8 liters. Even in some emergency conditions, we will start with 4 to 6 also. And 8 is a standard value. You can go blindly. No any complications will happen in that. It's only for per minute. Next, these are the emergency medicines. We should always have these set of medicines or have a good relation with the Shalya person in your department, in your institute, or a casualty officers, or postgraduates, interns, or nursing staffs who have qualified, and make the list of these medicines. These are very essential. Don't know when it is going to come to your help. It saves the life of the patient, and also it saves the reputation of the doctor also. So these are the normal doses we have to give. It's a per dose milligrams and all. So this tenexamic acid, buterpurs, and others you may be knowing. These are for hemostatic drugs. Tenexamic acid, that is, comes as a Texakind 500 mmCg or it comes in a 1000 milligrams also. So you can, it is a hemostatic drug. If there is a severe bleeding, you can go for that. And you should have a Tridosha Hara drug. Like we were taught by Ravishankar Purvaji sir during our undergraduations. He was telling we have to divide the medicines under 3 categories: Vataja, Pittaja, and Kaphaja, and also Tridoshaja. So here hydrocortisone is a Tridoshaja. It survives the patients from all kinds of ailments. It's a revival drug we can give to a patient, not to go into a shock. So it will be available in the OT. We will be using when the local anesthesia can cause kind of vasovagal shocks. To prevent that, and also once it happens, we'll give it as a reversal drug. Next is a insulin dose calculation. When you are treating a patient of diabetic who is under insulin intake, and also a patient who is undergoing weight reductions, and a patient who is having a hypoglycemic state also, you should know this. What is a normal insulin consumption of the body when it is not in the normal value? If the patient is diabetic, how you have to calculate it, and what is the 1 unit of insulin is going to digest the how much amount of glucose molecules. If you compare and see the reports of FBS and PPBS, if you have a 200 mg per dl is a excess to the normal value, you divide it into a divided it by 2 also. So then how much you will get? 100 is there. So 100 units of insulin is not working for him. Okay. So now in his body it is. Now it comes, what is the daily requirement of a normal person? It is about you can calculate even the body weight of the patient divided by 2. If your body weight is 60 kilos divided by 2, 30 units your normal requirement if you are a non-diabetic. If it is a diabetic, this requirement increases. Okay, so that also calculations you should know how you have to calculate the insulin doses. If in a diabetic patient you are performing a weight reduction therapy, you have to monitor, because as the weight reduces, insulin consumption may be a burden to the patient, is it not? So the weight is decreasing, but you are putting the patient on the same level of insulin dosage. One midnight he may go for a hypoglycemia. Okay, so that calculation should be present. Then how to handle a unconscious person. So these are all we know as a first aid treatments. We have to give an oral commands to the patient. Then how we have to make him to lie. Always make him to lie facing upwards or towards the light. All of you can make your head tilting backwards. You can see automatically your mouth opens and airway is opening. So this is the right position. Is it not? When you do, the mouth opens, the air enters through our trachea. So that is a normal mechanism which we have to follow in the whenever we see a unconscious patient. Otherwise there will be a respiratory arrest, or the tongue will be bitten by the patient, unconscious patient. And remember, do not give any oral medications in this stage. Okay, it causes aspiration pneumonia. So this is one important point you should remember always. If even though we are very much pro Ayurvedics, in that condition we should not give any of the oral medications. Try to depend it on the intravenous or the IM injections only if you want to give. Or maximum you can give a small dose of sublingual medications. That also increases saliva. There may be aspiration. Most of the times we'll avoid it. Only once the patient is conscious, then only start our medication so that he or she can swallow.
Someone must say nasal administration. We can do nasal administration of the
Yeah, that is there. Even in cerebrovascular accident, they'll do that. But not the oral medications you have to. In that also, if they are getting a more kind of secretions that has to be aspirated, you should have a setup for that to aspirate the secretions. Otherwise, those secretions also will enter into the trachea. It causes aspiration. So these are the CPR. The last option we have is a CPR. So we must know how to perform the resuscitation. Okay, so these are the 4 to 5 steps we have, and the 5th and 6th are repeating always, and this is a standard method to revive the patient from unconsciousness or to retain his cardiac and respiratory activities. So I would say, quote some of the examples. This is my own classification I have told, because there will be a set of diseases where we need to act immediately in terms of diagnosis also, and there are certain sets of diseases which we need to act based on the therapeutic also. So this you won't get in any textbooks, so don't search for that and don't say me that this is wrong. Now, this is just for your inputs, this is for your information. What is a diagnostic emergency? So this is a ECG of a patient who comes to us just telling a chest discomfort, and he does not have any other symptoms, and whatever the chest pain he is telling, it is more of a bony pain, not the muscular pain. No radiation of pain to the lower limb, upper limb, and there is no any white changes in the vitals. So why we doubted this case was he had a recent history of COVID. Okay, and you might have seen most of the patients after COVID is dying of heart attacks because of the T-dimers, is it not? So this was suspected in such way, and we had taken an ECG of this, and we were just confused, saying that this is a ST elevation with the T-wave inversion and all. But after examining the V3 and V4 leads, we could know that this is an extra U wave which happens in the electrolyte imbalances. So I kept this case is, after all your Svedana therapies, many of our patients will complain of a kind of discomfort or raised blood pressures and all, and most of us will come to us and we are going to, when we check the ECG, there may be some kind of variations. We know that's normal to that patient because of the treatments which were undergoing, but this should not be shown. This extra U wave formation after any treatments, which says that you have to concentrate on his electrolytes. There is some problem is going on in the electrolytes, and you have to give potassium mainly. Just you give a kind of fruit juices to the patient which is rich with the potassium, if you don't have any other means of electrolytes to administer. Then another case who is ready for all the admission, and he came to us just to undergo the Panchakarma treatment also, and his wife was having some other illnesses related to the Shalyatantra departments. So his low back pain was not like SLR positive, that kind of, it's not completely going towards the sciatica. We had a doubt. We just took a X-ray pelvis where it showed left hip is completely necrosed. You can see I have marked it is a avascular necrosis. If I would have asked him to just go and get a treatment, when you start a massage, this will break. Okay, so that's why this kind of emergencies also we should be aware of. Before recruiting the patients under the treatment, thorough examination, thorough diagnosis is also very important. This is another case who came to casualty, a 19-year boy who had just injury over the right shoulder, and he is just telling he needs physiotherapy and some the treatments. He was referred by somebody else who had already visited here, and when we examine, you can see this is an X-ray which shows that there is a calcification in the acromion process. that whitish is there, no? It's a calcification. Why it happens? Calcification happens only whenever there is a hidden trauma over a longer time. So I suggested him to go for a MRI immediately because he was not having this hyperextension of limb was restricted, which says that there is a problem to the SIDS, that is rotator cuffs. So it was not of a rotator cuff injury, it was of type 3 acromion process. In this case also, we'll try n number of ways to reduce the pain, but it won't reduce because it is an anatomical defects. So the convincing of the patient, giving a perfect physiotherapy movements are very important here. And after that, when we start our treatment, we will get a benefit. Otherwise, he will be losing the limb because muscle wasting will start. If you start applying oils and all, then the muscle wasting will stop. It's a kind of AMA conditions. So in AMA, you will not applying any oil directly, is it not? So you have to reduce everything, then only you have to start for the treatments. This is also another case. He was under Panchakarma treatment also because he is a patient of chronic kidney disease. One fine morning he started convulsions. Okay, so before that creatinine level was decreasing, increasing, urea and uric acid was also fluctuating. We didn't monitor much, but one fine day after a small procedure, because he had abscess in the gluteal region, after injection of that particular local anesthetic, we got a seizures. This is not local anesthetic or whether it was because of the uremia, we were confused. Because local anesthesia is also having a side effect in case of CKD patients. Okay. But when we detailedly examine this patient, he was having low oxygen saturation. So oxygen therapy was the one which gave him life back. Apart from all our medications, because the CKD patient abruptly we cannot inject any of the steroids there. So that's why we could only give the oxygen therapy. After 5 to 10 minutes of oxygen, 8 liters of oxygen per minute, he was stable to consider. Next, he will refer to the tertiary care centers. It's called as uremic seizures, which happens, and oxygen therapy is the one treatment of choice there. That's why we should know about that also during our treatment when we are treating patients who are having kidney related diseases. Again, there is a problem. Okay, commonly encountered complications. What will be the commonly encountered complications? Giddiness. Yes. Hives, itching and rashes. Then comes burns. Accidental burns can happen. Yes. Next. Fever. After nasya, fever can happen. Kshirodhara and all, fever will be there. Next comes the gastroenteritic symptoms will be there, either vomiting or loose motions. Next comes a headache or bleeding. We can treat these with our medicines only. No need to depend on allopathy medicines. You no need to get scared whenever there is a bleeding. You just make sure whether it is from arterial bleeding or a vascular bleeding or whether it is a capillary bleeding. This is your first point to identify whether it is from the vasculature or whether it is from the capillaries. For capillaries, give a pressure bandage. It is going to stop. If it is a vascular, you need a help. You have to do some procedures like Agni Karma also you can do, or even Kshara Karma is also helpful. You can take the help from the experts from the concerned departments also. And there is no need to get panic and get into the modern system of medicines. You don't know what may be the side effects and all. Then there is no need to give such kind of medicines also. Next is this is a references. All whatever I have explained so far, comparing it with the modern system of medicine, is present in this chapter. That is Murcha Pratishediya Adhyaya. So even the fan, use of fan is also told. That is, ventilation should be maintained, airway should be maintained, breathing should be maintained, cardiac output, circulation. Everything is explained hardly in 4 or 5 shlokas. So you can go through, and even the medications in the form of aromatic drugs, which is having a sweet in taste to maintain the sugar levels, which is having a lipid molecule to give the strength and also to increase the oxygen carrying capacity. You can analyze now when you read that chapter again, because you have seen so far how we can compare it with the modern system and how our medicines are far better in taking the oxygen molecule in the body, and it maintains the oxygen saturation. So all these are present in this particular shloka. See, this is the first line. You can just go to Sita is there, Priyala, Ikshurasa, all Madura. You can maintain the sugar level of the patients. Draksha, Maduka, Eshti Madhu. It is also a kind of aromatic. Its smell is also giving a soothing effect to the patient. And the direct reference of even Gandha Dravyas are also told in that particular chapter. And you can see the last shlokam, Kvata or Grita. Same way, wherever you see the description of the ingredient, they will say either Kvata or Grita. You can use in both the ways. So it's your yukti how you are going to select the particular yoga. Whether you are preferring the patient to give in a Kvata form or whether you are preferring it to a Grita form, provided you need to make sure what is your aim. Why you are selecting this medicine. If you want to increase oxygen, give with the Grita form. If you want to give only nutrition, give with the water base. So that is the basis which we are going to get in this particular chapter. These are all, I would say that these are the examples what I have shown. See, simple thing, whenever we are doing Rakta Mokshana, Yavagu Pana is told. Mamsa Rasa is also told. And Yavagu mixed with Grita is also told. So why, see, there is already it is present. You have to mix a lipid media in the diet of the patient so that he will not go into any of the complications. Okay, which is, we are neglecting such points. We are not concentrating what Acharyas have really meant in explaining those shlokas. This is one case, I would just say. This is a case which came as a prolapsing gastritis. It's nothing, its name is the only big one, nothing. The patient has severe vomiting. It's a drug reaction he got, and severe vomiting was there, and the vomiting was non-stop for 2 days. Then they took endoscopy. In the endoscopy, the mucosa of the gastrium was little bit detached, a kind of ulceration formation only, but it's not completely formed. So what is the treatment we had given? It's only the Ashtabaduk Sherapanga. You can, because patient cannot withstand any of the medications. Whatever you give, he vomits. Whatever you give, he vomits. So this is GRD treatment. You can give for the treatment of Amla Pitta can be given here. This is a simple drug. It gives a nutrition. It is easy to consume, and it is in a liquid base, easy to absorb. Its action starts from the tongue, and when it reaches to the stomach, patient's problem will starts to decrease, and even it heals the ulcerations which was formed in the gastric mucosa. So this is an endoscopic report saying it is prolapsing gastropathy. Pathy refers to the any condition. It is a pathological condition where the mucosal layer is prolapsing from the wall of the stomach. Okay. So this you can expect whenever there is Ati Yoga form. One of you are telling, no, the complications will occur whenever there is a Ati Yoga. You can expect this also. No need to worry. In that condition, you can prescribe these medications.
What is the dose?
50 ml to 100 ml you can give. 100 ml per dose. and 3 gram you have to maintain as the dose of the drug. It is a classical reference. If you give more, it will induce vomiting. Yes. That is very important, the dose determination also. And this is commonly encountered, I think hardly another 5 minutes. And those are all, again, the fissure, polyps, or diverticulums. We will be in trouble when we are performing treatments like Basti. Whenever a patient is having fissure, polyps, these are all bleeding diseases, and diverticulitis also. And there are post-surgical cases also. I had a report, this is a report, where patient had undergone intestinal anastomosis who was suffering from post-anastomotic Crohn's disease or ulcerative colitis also. You can consider it was in the, I think it is in the level of, what is that? Mucosal ulcers only. So that this is a case in case of all Crohn's disease or ulcerative colitis, we opt for a Pichavasti. But this condition is quite dangerous. Do not go for any of the interventions or a large amount of fluid administrations in case of anastomotic conditions, because we don't know when the anastomosis can get infected, because ulcerations will be very near to the anastomotic site also. We will be in trouble. In such cases, try with medications, and if it is very essential, we have to get a very small dose of the liquids. Okay, that is a yukti of the practitioner to decide based on his condition and his symptoms. But if it comes to us, we will reject it, like we will not advise any of the treatments. We are confident to administer, but make sure that it should not cause burden on the intestinal suture lines. So these were the points which I wanted to just share with you. As all of you know, there are some kind of emergencies can happen every day in our practice, and instead of depending always on the allopathy medications, even we can manage some of the conditions with Ayurveda medications also, but provided we should have a proper base for that. We should know the physiology, we should know the pathology, what's happening in the disease, then only go for the drug administrations and all. And that's all from my side. I think I have not made you to sleep in the post-lunch section. And if you have any queries, I'm most welcome for that.
The session is open for discussions.
Then due to the woman, if there is Jiva Dana, then in Ayurveda, how can we manage?
Tough. Because see, that's what you have to look into the the vitals of the patient. Okay, vitals are also collapsing. Patient is going to syncope, means we cannot give any oral in such conditions. We need to depend on the parenteral drug administrations or IV fluids only. That's why I told these concepts you can give to the interns or even to the postgraduates who can train. You can train them. If such situation, you are the responsible person like that. So it can be managed not with the oral medications. We need to depend on the parenteral circulation, parenteral drug administration only. Yes.
If any CKD patient is there and in emergency condition is acidosis is developed, then any Ayurvedic medications we have that we can manage?
See, before onset of acidosis or alkalosis in such condition, patient will be getting a seizures. That is the main thing. So before we assess those levels, the seizure management is more important here. Once you settle the seizures of the patient, you can give even our medications or even to the other medications like allopathy medications also, provided you must know what is the ingredient of those. Okay, because in allopathy also there are only certain set of antibiotics are also given, and also painkillers, antihypertensives are also specific to the kidney disease patients. So that kind of categorizations we have to make. I cannot randomly tell that yes, you give this, the patient will be fine, but in such conditions we need to make a proper categorization of our ingredients first. What medicines are available? If you say I have only Rasaushadhi, we will doubt whether we can give it or not. We don't know. If you have only Kashtaushadhi, we can say whether the patient convulsion is there, whether I can administer in the Kashaya form or in the powder form. If you administer in powder form, the patient will get a cough. If you administer in the Kashaya form, there will be aspirations. So that conditions will happen. So that's why you manage first the convulsions, then you can plan for the other.
During this once we tried it with Khadiradite.
Okay.
Severe sneha occurred and the patient got severe cardiac arrest.
Yes.
Then we have to suddenly refer and he died. So in these cases we tried all the Takra, but they didn't work. So anything we can do like.
So in that even there is Rasaushadhi, certain Rasaushadhis they will give sublingually. You can make Siddha Makaradoja itself. They are given in very small doses in the sublingual condition. At least that will maintain oxygen saturation. Okay. So once the patient that dyspnea is settled down, you can go with the oral medications. This is all. This is the same principle all the doctors are following in cerebrovascular accidents also. You immediately when the patient admitted, you give an NG tube, irrespective of Ayurveda or allopathy hospital. Why? Because you can administer frequent medications through that. This is one options. Otherwise, we don't have a setup to do so. Then we can go for a sublingual administrations, but it should be very in minor dose. Because it.
How much dose?
No, one tablet, if you are telling that you want to give him one tablet, a small milligrams should be given at a time, because when you give a sublingual tablet also, there will be increased of saliva. If a saliva is increasing, it goes into the trachea. Patient gets aspiration. So that also you should monitor. The head position should be monitored, maintained. Then only airway should be clear. Then only you have to give, just to attain the consciousness and all. So Rasaushadhis will work, but provided all these measures you have to take, not to go for patient into an aspiration.